Today, we have a very sad news to inform to all of you. One of our faculty who used to come to our forum to educate our viewers internationally and locally, Dr. Mini Unnikrishnan, who is a well-known, dedicated homeopath who particularly practice in gynecological and obstetrics problems, especially in infertility areas, died yesterday night with a accident. Another homeopathic organization awarded her with an award, and she went there to receive the award, and on the return, her car was hit by another car, and she died yesterday night. And this is a very sad news for us. It was a great loss for homeopathy in Kerala and internationally, though she focused her practice in Kerala. And we deeply regret her death and express our heartfelt condolences to the family, and we express our prayers for the eternal rest of her departed soul. And another small baby also died in the accident with her, that is none other than her grandchild. So we express the deepest condolences again and request you to keep 1 minute silence on behalf of IFPH and all those who gathered here to respect and honor her as a person, as a homeopathy doctor who contributed very greatly in homeopathy practice and especially in gynecological diseases. You can visit our YouTube channel to watch her immensely knowledgeable videos, mostly in our local language, Malayalam, and there are, I think, few in English also. So I request all to keep 1 minute silent prayer, 1 minute in silence to pray for the peace of her departed soul. Thank you.
Today our guest is Dr. Pradeep Kumar Gupta, MD, Homeopathy in Repertory, Materia Medica and Organon of Medicine. He is a founder, chairman and principal, Naminath Homeopathy Medical College Hospital and Research Center, Agra. Chairman, Naminath Ayurvedic Medical College Hospital and Research Center, Agra. The topic is palliative oncology, a very important topic, and homeopathy has got a tremendous role in giving some sort of solace to these unfortunate persons. So on behalf of IFPH, I welcome Dr. Gupta. You can have a platform. First, next 45 minutes. It's over to Doctor. Please proceed.
Good evening, everyone. The problem of cancer is rising very fast, and I'm very upset today. I seen 6 young men suffering from cancer. In the first time in my OPD, 6 young men came for treatment of cancer. So it is the biggest challenge now that the so-called modern medicine is not capable to deal with this deadly disease. But we can very easily treat this disease because cancer is nothing, it's a sora. And if wrongly we go on the line of the allopath that it is first grade, second grade, third grade, fourth grade, whatever the grade metastasis, this is all useless for us. We have, as a homeopath, we have to understand only one thing, that cancer is a soric disorder, and the whole aim of the homeopathic physician is to find out the proper antisoric. Our biggest irony that our most of the so-called stalwarts give the disease on the name of the cancer. So the whole idea is that the cancer can be treated as a ordinary soric manifestation, and according to the totality of symptom, from aconite to zincum metallicum are useful drug for the cancer. There is no specific drug for the cancer. Some people say this is organ medicine, some say this is that medicine. This, I don't buy these arguments. I have a large number of cancer patients always in my OPD and IPD, and I never differentiate them in any point of the way. So here I just want to share some glimpses, because 1 hour is very less to talk on this subject. This is the campus of Neminath where I do, and this is the Neminath Homeopathic Hospital. This is the first NABH hospital of India. Our father of medicine has said that natural forces are within us, are the true healer of the disease. So we have to find out the natural forces, which Hahnemann has said the vital force. So we have to just empower the vital force by correct antisoric remedy. That's it. Great Paracelsus has said no illness is that grave that would not have its cure in medicine. So every illness have its medicine. It's the duty of physician to find out that medicine. And that the path shown by the Hahnemann, the totality of the symptoms. This is from Kabir Das, that सब कहते हैं पोथी लिखी, मैं कहता हूँ आंखें दिखी. Means everyone is saying whatever written in the books. But what I say, whatever I have seen in the patients. So here I follow the Kabir Das. These are the images of patients taken from our OPD cases. So everyone knows that what is neoplasm and neuro, so I will not go on the detail. This malignant and benign. I just come to the topic. Breast cancer stages and the best treatment, only 26% people survive in the 5 years. And the other colorectal cancer, only 13%. So this is the result which, and the lung cancer, only 4% patients. So these are the results by the allopathic medicines. So the biggest challenge for us, what to do? The art of healing comes from the nature, not from the physician. Therefore, the physician must start from nature with an open mind. We all the physicians just forget what to do. We just go for the MRI, CT. We never understand what is the symptom of the patient. We just go for laboratory reports, this and that. So here I want to say everyone that don't go on that, just start from the nature, what the patient is saying, what he is feeling. And the last word of Dr. Paracelsus, that the doctor can have a stronger impact than any drug. If a physician who is treating the patient, if he himself is not sure that this is a patient of cancer, it will be all right or not, so patient will never be all right. So personality of the physician is more important than any drug. Yeah. Sharing is stopped.
Yes, sir. Now it's okay.
So here I am showing a case of carcinoma of lung. This is the patient, Uttam Singh, 62-year-old male. Address is Niwari, Tikamgarh, and the Madhya Pradesh. He came from the Madhya Pradesh. So this is a conversation in my OPD. So it's a known case of carcinoma lung. The symptom narrated by the patient in the OPD: constant severe pain in chest with weakness. Ghabrat means restlessness since 10th December 2021. Severe breathing distress on walking. Paroxysm of cough with vial expectorant and watery discharge in shunt. Redness in eyes. Complaint begin with the breathing distress and heaviness in the chest. Ringing in the ear, or he feels the ears are blocked. Difficulty in breathing. Restlessness while bathing. And this restlessness increased as if fluid in the lung increased. So there was a lot of fluid in the lungs due to this carcinoma. Pleurisy lung, complete right lung and partial left lung. After consultation, shunt made in lung to drain the fluid. Must empty the bag at least twice during night only. So only in the night, approximately 2 liters fluid are coming from the lungs. Patient was already admitted in All India Institute of Medical Science, from where he reached to me. The past history was renal calculi and typhoid a month ago, for which he took the allopathic treatment. The family history: father cardiac arrest, diabetes mellitus 2, 3 uncle, 1 carcinoma throat, 1 diabetes and 1 cardiac arrest. 1 brother cardiac arrest. So in the paternal side, lot of people have cardiac arrest. And in the maternal side also cardiac arrest, asthma, cardiac arrest. And one sister, CA liver. So the cardiac problem and the carcinoma is running both the paternal and maternal side. By occupation, he is a driver, smoking addiction, 2 packets of BD per day, married in 1984, 1 male child and 3 female child, and diet mostly vegetarian, non-vegetarian occasionally. Appetite tolerable, thirst 3-4 liter a day, tongue white coated, salivation present, desire sour, apple and curd, stool 2 times a day, urine satisfactory, perspiration more especially on thighs, chest, thermal reaction hot, sleep right side, uncover the face. Mental journals, anger expressed, desire for company, easily involved with the people. He was not on regular job, depends on wife for expenses of family and its bread and butter, as he is a government job. Married his second daughter in 2015, but son-in-law is alcoholic. This is the stress. So now you make your own totality. I had given all the symptoms and just an exercise in your mind what to give. Prescription. Carcinoma lung, pleurisy, 2 liter fluid per day, admitted in various allopathic hospitals, already had a shunt in the lung and came for the treatment in a homeopathic hospital. And the OPD conversation we all have seen. My prescription was sulfur LM1. One globule mixed in 100 ml of water, 5 ml solution mixed in a cup of water, a small quantity of from this to be taken. And I repeated medicine very frequently. Those who follow me, they know my dose is 5-minute interval, 4 doses. This is his report. बात कर लो. Malignant cells in cytology, pleural fluid. This is the histopathology, final report, pleural fluid, cell block, metastatic adenocarcinoma, primary pulmonary origin. This is the report from Tata Memorial Center. He also visited there. So he visited many hospitals of allopathy, but no result at all. So this is the video on the very first day in my IPD. Soreness of throat is reduced, but the fluid discharge is persisting. Restlessness is reduced and breathlessness is reduced. So now I sulfur LM2 1 hourly. इसको पूरा लिखना है बेटा. सुबह इतना तो नहीं है, बढ़ गया. सुबह तो नहीं था ना. शादी कर दिया ना. सुबह से इतना है. कल इतना है, इतना ही था. कोई अंतर नहीं. Fluid still persists, but cough reduced. The other elements are reducing, not the fluid. So I increase the potency LM3 2 hourly. So listen the conversation. What patient and attendant is saying, that this is the day 3. There is no fluid is coming now. No cough and no fluid. When the so many allopathic hospitals fail to deliver the result by chemotherapy, by radiotherapy, and your sulfur stop the fluid only in the day 3s, also the cough, also the breathlessness. See the happiness of the patient face and on the attendant also. He is the son. Fluid from lung didn't increase a bit since is admitted, sleep good, no cough, paroxysmal cough, no sore throat, no coraza. Son is very happy, sulfur LM 3 hourly. Now the follow-up after 15 days. Listen what the patient is saying. So he was discharged on day 3 and I didn't take out his tube as he fearing that the pleural fluid may come again. But whenever he reached his hometown, he gone to the surgeon and he take out the tube because there was no fluid after 7 days. So now he is not carrying that bag and the tube, and he is confirming that he is absolutely all right. So this is the power of correct symbolism, and if you understand the case well. The symptom which I have mentioned, fluid discharge not stopped from the next day. So lung was removed. Cough sometimes at night, appetite good, breathlessness reduced markedly only on exertion. Taking bath easily now, no restlessness, no ringing in the ear, no coryza. Since then, till now, he is completely fine. So it was almost 2 years. We are having actively his follow-ups, and he is absolutely all right. And the sulfur LM3 is still being given 2 hourly. So this was the first case. Now I am going to show another case. This is a child with renal
Sir,
carcinoma.
why sulfur given, sir?
This is not the question answer session. Just wait.
So it is accidentally happened, sir. No question.
Okay, no problem. I will give an answer of each and every question. I love questions.
Yes.
So those who
yes,
are
sir.
connected with
Yes,
me,
sir.
be sure I will not leave the platform till every query has resolved.
Yes, sir. Up to 9 o'clock, 8:45, you can have the session, then 15 minutes for questions, sir. Yes, sir.
No, I can take all the question.
Yes, sir. After 9 o'clock, we have the Malayalam session. Okay, sir. Thank you.
Okay, no issue.
Yes.
So, case of renal carcinoma. It is a child named as Farman. 75 age जल्दी उसकी 15 को 75 को बाद में कर दिया
कब से हो रही है बेटा ये परेशानी और क्या परेशानी हो रही है आपको
आते मामा हो रही जलन से वगैरह और कब और बस ठीक है कुछ तो दर्द
इसके लिए कोई किसी डॉक्टर को दिखाया आपने कहीं
नहीं सलमान डॉक्टर दिखाया था
उन्होंने क्या बताया क्या बताया
वो पकड़े करने थी बोलने के हम बता बोलने के साथ इन्फेक्शन कर लिया था बच्ची बताई दवाई जरूर
डॉक्टर ने क्या बताया क्या परेशानी से चलो फोटो में कैंसर की बात
pain in right side of the abdomen since 2.5 months, aggravation, motion, walk, amelioration, rest, massage, severe burning in palms and soles, aggravation night, amelioration cold air, blood in urine since 1 month, aggravation night during urination, amelioration rubbing the lower abdomen, severe weakness since 5 months, hard nodular swelling in abdomen covering right half of the abdomen, below umbilicus since 3 months. Pain in this nodular swelling on abdomen, aggravation, lying on affected parts, lying on affected side, amelioration, rest and massage. Past history, typhoid 5 years ago, history of dog bite at the age of 4. He is 15-year-old child. This is a family history. Father, brain hemorrhage, died. Grandfather died. Grandmother, diabetes mellitus. Maternal side, mother, hematoma. Grandfather died. Grandmother died. Nothing more. Non-vegetarian and a student. Physical generals, appetite good, tolerable. Thirst 2 to 3 liters per day. Desire tea. Stool satisfactory. Urine uncontrollable. Sleep disturbed. Thermal, ambithermal. Mental general, history of grief. Father expired 8 months ago due to brain hemorrhage. And after that, mother suffering from hematoma. Desire for company, sudden change of mood, in anger bites other. These are the investigations. This is the investigation already has done. We go only on the conclusion. Findings are suggested of mitotic pathology. Cytology, aspiration from right leg fascia, renal mass. Cytological feature are suggestive of malignant epithelial neoplasm, possibly renal cell carcinoma. So it's a case of renal cell carcinoma. Montreux were negative to confirm that it may be diabetic lump, but before that, So it is confirmedly by the cytology that it is a renal cell carcinoma. His hemoglobin is 7.6 and the neutrophils are 72%. So what to prescribe now? Anna, do you have any idea?
Yeah.
So just understand what to prescribe and I am going to surprise you what I have given.
Is the biting important?
Is that?
The biting. Where he bites people when he's angry?
Yes. Correct. You got the right point. So any idea of the medicine? No? Belladonna LM1. I never see cancer. I say who is sick. I see only that. So come here. Desire for company. Sudden change of mood. In anger bites others. So angel when well and demon when sick. Also come to the interview first. Look, this is a child. He is having renal cell carcinoma and very painful. And just watch his conversation. So I got him admitted and thereafter this medicine was prescribed. And see. Friends, it's a case of renal carcinoma. As a small boy, and it is a case of renal carcinoma, so the heart goes. And it was कितना दर्द था बेटा पहले से?
पहले तो बहुत था कम हो
अच्छा एक दिन में कितना दर्द कम हो गया ये बता दे.
हाँ थोड़ा सा
थोड़ा थोड़ा बचा है या थोड़ा ठीक हुआ है?
थोड़ा ठीक है
Okay, ठीक है. So much big disease and so much pain, and the boy is laughing. So everybody should guess what is the medicine. The medicine has been prescribed by me. That is belladonna. And the misery of the teaching of the homeopathy that people understand the belladonna is the acute drug. Actually, there is no acute or chronic. Drug is drug. Totality is totality. So I am given belladonna for renal carcinoma, and the child is much better. Here's the report. कॉपी लगा ली इसमें ये भी केस ऐसा है जो so another symptom emerges after belladonna, laughing while talking. He is confirming the pain is reduced but not much reduced, and in so much pain he is laughing. So this is the correct understanding of the remedy at the bedside. Pain in abdomen is slight better only in day 1, less than 24 hours. Aggravation night, pain is better. Patient is very happy and laughing face. Nodular swelling on abdomen is also better. So I didn't change the potency or the repetition. Belladonna LM1 1 hourly. Now the day 2, second day. Listen what he is saying. So only day 2, the tumor size also reduced. And the mother also confirming, I also examined, and the patient himself saying his node is reduced. Node is slightly soft also, not so hard as it was yesterday. Size of node reduced, pain in abdomen much better. Nodular swelling of abdomen is slight better. So same medicine and same potency and same repetition. Day 3, look the happiness on the face. So this is homeopathy. What homeopathy can do, nothing can be do. No chemotherapy, no radiotherapy, no surgery can produce this kind of result. So homeopath has to understand the power of their prescription, power of their correct remedy. And I enjoy this happiness every day in several cases. Look, happiness. So the child confirming that pain is very slight remaining and the nodes is also reduced much. This is only day 3. Cough is better, pain abdomen better, nodular size of reduced, no new complaint. Belladonna LM2 1 hourly. Look the happiness day 4. So this is the changes of the body language, changes of personality. This kind of changes only homeopathy can do.
पूरी तरह से दर्द बंद है? कब से बंद हो गया है? कल से पूरी तरह दर्द बंद है, बिल्कुल नहीं हुआ। हल्की खांसी। अच्छा, जो गांठ सी पेट में वो कैसी है? कुछ कम हुई है? लेट जाओ, लेट के दिखाओ, लेट के दिखाओ। हाँ, टाइट में कम हुआ है। हाँ, हो जाएगा ठीक। ठीक, सॉरी।
So it is short time, only day 4, no pain, size is reduced, tumor is soft, no tenderness, and people think belladonna is a acute remedy. So I purposefully showing this case that remedy is remedy, neither acute nor chronic, neither short acting nor deep acting. You just try to find out remedy, don't go on the nonsense. Pain in abdomen completely better in day 4. Size of node reduced further. Cough is better. Tightness of abdomen is better. Belladonna LM3 1 hourly. Day 5. Only day 5 I have discharged him. So I show you 2 cases here. One case came from many hospitals. I discharged him on day 3 only. And after a week, his tube was out. No discharge. And in this case, only 5 days, no pain, no complaint, and size is reduced remarkably.
Yes, sir. Wonderful case.
Listen what he is saying.
Yes.
Still it is visible. The tumor is still visible, but much reduced than before. All complaints are better. Pain in abdomen, no. Tightness, better. Cough, better. No new complaint. Belladonna LM3, repetition 1 hourly. And I discharge the child. And he is absolutely all right.
Oh, well, I had a few questions. I just wanted to clarify something that I know Dr. Pradeep's mentioned before. Hahnemann has the chronic diseases remedies, and then he has his non-antisoric remedies. So does Dr. Pradeep set aside that splitting that Hahnemann did of the remedies and just go in with a non-antisoric remedy like belladonna as easily as with an antisoric remedy when it's needed? Yeah, Dr. Pradeep's nodding.
Thank you, Anna. Thank you for raising a very well question. What he write in edition first, he changed in edition 2. What he write in edition 2, some portion he changed in edition 3.
Okay.
So whatever he write in edition 4 changes in 5.
Okay.
So the dry dose up to the edition 4. Now in the 5 and 6 he mentioned the water dose.
Okay.
And in the 6th edition he mentioned the LM potency. So few medicines like gelsemium, he first put on them in antisoric, Meserium also antisoric, then taken out. So it was his experiment. And I believe that his experiment was nice and everything fine. But what I observed in my IPD, because I am running indoor patient department since 2007 in my hospital, and I have a large number of admitted patients. So my understanding that I have cured serious pathology by gelsemium.
Right.
I have cured so many pathology by ignitia.
Right.
I have cured so many serious pathology by Hyoscyamus. So in my opinion, though he didn't mention and take out some remedies, they are not antisoric, but might he survive few more days, more years, and with the experimenting the things, he might include them in antisorics. So Hahnemann, by such a genius, he never say that you don't experiment. If your experiment is on the right track, you can experiment on that. So this is my suggestion and this is my research that I found these remedies are not acute. They are very helpful in the very serious cases like aconite. In my entire life, I never prescribe aconite on acute condition. I prescribe aconite always in the chronic condition and I found the result. So my humble submission to the fraternity, whatever written by the Hahnemann is absolutely all right, but he never stop you researching. So do the research.